Music hold ended.
Good morning and welcome to the West Virginia Families Who Care Tele-Town Hall. My name is April Burdette and I am the proud president of SEIU Local 2015, and I'm also the chair of the SEIU Home Care Council. No matter where you live, no matter what your circumstances are, care is essential. Full stop. And at some point, you're going to need it. Today, we are taking action to safeguard home care for everyone who needs it now, future generations to come. Care workers are strong. We are compassionate. We are civically engaged, and we are determined. We are frontline workers, and there is nothing that we won't do to save lives and serve our communities. Over the past 2 years of this pandemic, we have seen it all, and we've pushed ourselves to the limit. And yet, our fight isn't over. We are raising our voices today to demand that Congress pass a critical investment in our nation's care system. A federal investment in care would have an enormous impact in West Virginia, which is facing both a rapidly aging population and a critical shortage in care workers. More than 1 in 4 West Virginia residents will be a senior by 2035. And just by 2028, West Virginia will need to fill more than 20,000 home care job openings. We're going to make sure that Congress gets the message. We're going to call them, we're going to text them, we're going to email them. Every possible way to reach out, we're going to do it. Throughout this program, we'll share ways in which you can make your voices heard. Today, we're going to hear directly from care workers in West Virginia and family members who depend on care, as well as local union leaders who are at the forefront of this fight. And along the way, we'll hear from some other special guests, including the mayor of Charleston. And we have a daughter of West Virginia who's a celebrity that I'm going to make you wait for. But first, we're going to hear from my leader, Mary Kay Henry, our president of SEIU. There is no other leader like Mary Kay. She has been an outstanding champion for care and understand the role it plays in building an inclusive economy and thriving communities. Let's turn it over to Mary Kay.
Thank you, April, for your tireless leadership in highlighting the importance of care work across the nation. And thank you to West Virginians who are tuning in today. Whether you are a home care worker or you or your loved ones rely on care workers, you know that care is essential. Today, we need to send a strong message to Congress not to miss this opportunity to make home care affordable and ensure that home care jobs are good, paying union jobs. With inflation rising, President Biden has spoken about the need to lower costs for families. And one big way to do that is to make care more affordable for those who rely on it. It's one of the biggest monthly household expenses for families. An investment in care is also about lifting up this primarily female workforce that for far too long has been overlooked, undervalued, and underpaid. Like other essential workers across our economy, care workers deserve a living wage, safe working environments, and paid time off for when they're sick or need to take care of their own families. In West Virginia, the average care worker is paid less than $10 an hour, even as the wealthiest Americans and corporations avoid paying their fair share in taxes. What does that say about our nation's priorities? All of us have a stake in strengthening our care system because these jobs exist in every single community, rural, suburban, cities, and because care work enables all other work to get done. At some point in our lives, each and every one of us will have a need for care. And we know that we want the choice to be able to receive care in the place that is most comfortable to us and the place that makes us most fulfilled. Let's send a message to Congress. Invest in home care now and make care more affordable and accessible. This is a chance to create a more equitable and just economy. Those who provide care for our communities must be able to build a solid middle-class life and a brighter future for their families. And those who need care should be able to afford it. Thank you.
And thank you, Mary Kay. So well said as always. Next up is Deanne Burdette, sharing her story about the need for seniors to be able to age in place with dignity and affordable in-home care.
I'm Deanne Burdette, and I live in St. Albans, West Virginia. This is my dad. That's his senior high school picture. In their final illnesses, my parents needed in-home care, and we were having great difficulty finding anyone. I would try to line up caretakers for them. Sometimes it worked out, sometimes it didn't. I was still working then. I had teenagers at home and my own household to run, but I was the one who had to make sure someone was with them day and night. One period of time I spent every night for 6 weeks at their house. I had to lay out their medications for them, make sure they got their medications. I had to go to the grocery store, make sure there was food in the house. I cleaned their house. I got down on my hands and knees and scrubbed their bathroom floor. I don't even get down on my hands and knees and scrub my own bathroom floor, but I did theirs. Just whatever was necessary to see that they were taken care of. And it was a tremendous strain, I have to admit. You know, emotionally, it was a terrible strain. We tried as much as we could to keep them at home, but eventually, as their conditions deteriorated, we had to place them each in a nursing home, which I really hated to do. If I had had access to affordable in-home care, it would have greatly reduced the stress, and I could have just played the role of their daughter and not the role of their caretaker. Senators, West Virginia families want and need care now.
I am Denzel Norwich, and I am 75 years old. I have been a home care worker for 15 years now. The gentleman that I worked with was a quadriplegic. My job was to be there any time that he needed me. There was many things that I needed to learn and that I needed to know. This is a job that I became very proud of doing. It really hit my heart. I had very strong support from the family. He weighed 250 pounds. In turning him and moving him around, his father or the stepfather, either one, were always there to help me. Home care can probably be one of the biggest challenges. We are a very low-paid group of people. There were many days that I would work a month at a time, 16 hours a day, just because we did not have the extra help that we needed. There is a lot of young people who say to me, "Oh, I wouldn't mind doing that at all, but I cannot do that at that rate of pay." And that is our biggest obstacle right now. You have many people out there who need help. If we could get the pay raise to go up a little higher, I think we would get people to do work like this. We're not asking for trillions of dollars. All we're asking for is enough money and enough pay that we can live on.
Thank you, Deanne, and thank you, Denzel, for sharing your stories with us. Now it's time for you to take action and contact your West Virginia senators. You can call 877-207-0266 to leave your personal message. And now it's time for one of our special guests, and we're going to be joined by the Mayor of Charleston, Mayor Amy Schuler Goodwin. Mayor?
Thank you so much. Thank you for having me this afternoon. It's so great to be with so many West Virginians and essential home care workers who have been on the front lines and who I've had the pleasure and the opportunity to work with, especially during these times during COVID. Thank you. Thank you to your families, and thank you to all of our communities who support you. This is a live broadcast, and you can tell maybe my hair is still wet. It's because my husband and I were just bicycling outside for a nonprofit who tries to raise awareness to get critical services, in-home services for our seniors and those who need help, transportation to medical appointments or to the doctors or to the grocery store, or to bring them meals. So we literally are with you every step or every pedal push away. As a matter of fact, I left him on his bike earlier to be here with you. Because we know this as a family and as mayor of this capital city, that often caregiving work is undervalued. It certainly leads to high turnover and instability. And I know as an employer of 775 people in this capital city, when care workers aren't available, a lot of that responsibility comes to our family members, leading to a big struggle in work-life balance and the significant challenges it brings. But I want to say thank you to you. And through your efforts, you are currently taking the needed steps, as so many are, to work towards a durable and a long-term solution. Thank you for allowing me to be a very, very small part of your day. Please know that we support you. Thank you so much.
And thank you so much, Mayor Goodwin. We think it is so important for leaders in Washington to hear from local leaders like the mayor about what the realities are like in the communities they serve. Next, we'll hear from Scott Lancianese. I knew I was going to do this. Scott Lancianese. There we go. Here with Scott.
My name is Scott Lancianese. I'm 62 years old. I live in Mount Hope, West Virginia.
I'm Vicki Lancianese, Scott's wife. I'm 58 years old and live in Mount Hope, West Virginia.
I've had home care 3 different times. I had a stroke. I was injured real bad in the coal mines.
Most recently, 8 years ago, he had a stroke, and we were told he would never walk again, never speak again. They said the only other options when they were getting ready to send him home was that he would have to go to a nursing home, or we could take home health care at home and see how much they could get him to advance through that with physical therapy, occupation therapy, and speech therapy. So when I brought him home from there, he could not walk. He was only weight bearing. And through the therapists that came to our house and helped him, they had him up walking with his walker, and he became more independent. He was able to, through speech therapy, he was able to speak again. We never thought we'd hear his voice. They helped him with his speech. He had a stomach tube in. He couldn't even eat. They worked with him on that. He can eat anything he wants now. He's a lot more independent.
And these ladies did a tremendous job. Without them, I would nowhere have gotten any better at all.
The benefits of having home health care were allowed Scott to come home, be home with his family, be in his own bed, his own home, and we'll have family come to visit him here. We have our dogs here, our children can come visit.
And this gives me a better quality of life of what these women have done for me and through the healthcare system. Without it, like Vicky said, I would be more or less a vegetable in a nursing home somewhere just tucked away.
I would like to say to our senators that they need to remember West Virginia has the third highest rate of population of elderly. Also, black lung is rising. Just recently, Scott was diagnosed with black lung. There's going to be a lot of coal miners and a lot of our elderly that depend on our home health care. I mean, without that, and our state is, we will have nothing if we can't take care of our elderly and our miners that have been the backbone of our state. Senators, West Virginia families
want and need care now.
As caregivers like me, all over the country, we've been organizing, we've been fighting, and we're fighting for living wages, health benefits, and then also the right to form a union. That's going to make a big difference here. And then when I say we can't wait any longer for the investment in home health care, neither can our clients. Our clients need it the most, and they're who we're there for. It's time to fix this broken healthcare system. A lot of times, we are the ones that are on the front line. When we notice something, we notice, we speak out, and we make sure not only does the nurse know, but the loved ones know what's going on with their loved one. We do become family. Those who in Washington, I need you to move and move today.
That's
move
right.
yesterday, because it's due us. And when you need us, we'll be there for you too. All I ask is pay my other brothers and sisters what they are worth. And when you're making these rules, invite some of us to the table. Because
That's
we
right.
can tell you exactly what needs to be done
That's right.
and how to do it.
That's right, Christina. We need your voice and we appreciate you. And thank you, Scott, for sharing your perspective on why care is essential. Now it's time again for action, for you to take action and contact your Virginia senators if you haven't already. You can call 877-207-0266 to leave your personal message. And now let's hear from Ashley Orndorff, who cares for her daughter.
My name is Ashley Orndorff. I'm 36 years old and we live in South Charleston, West Virginia. My daughter is 8 years old and has Down syndrome, and we participate in our state's IDD waiver program, the Intellectual and Developmental Disabilities Waiver Program. So I am paid as her caregiver for personal care in the home, but we also have in our budget hours for respite care in the home. But currently we're unable to find anybody to fill that position, so we don't have any outside help coming in the home. I have to help her change her clothes, go to the toilet, brush her hair, fix her hair, brush her teeth. I have to set up her breakfast in the mornings. And then she goes to school. When we go to baseball, I have to, go out on the field with her to be close by in order to tell her where to go, or, not run off, or, not get in the way of another player who might be running to a base or something, because she doesn't recognize those safety risks. If we had somebody coming in the home to help care for my daughter, that would free up a lot from me, a lot of responsibility as far as, having to put off some duties for when I'm not helping with my daughter or taking care of my daughter. And it's not the typical parenting duties that I need help with. It's the extra that comes along with having a child with a disability, So having somebody come into the home could help kind of occupy her and work on those strategies with her while I can, fix dinner or run an errand or go to a doctor's appointment. And I wouldn't have to worry about, where is she? Is she safe? What's going on? There's somebody who's trained and understands her needs and can make sure she's safe and taken care of. If I were talking to a United States Senator, I would want them to know how important it is to invest in our families and invest in the services that our families need, including respite workers and in-home caregivers. Senators, West Virginia families want and need care now.
That's right. We want and need care now. Thank you, Ashley. Your care for your daughter is selfless and it's important, and you absolutely deserve respite care. Now we'll hear from Treva Simons about the need for care for people with disabilities just to get through the day.
My name is Treva Simons. I'm 59 years old. I live in Ripley, West Virginia. I have in-home care because I am legally blind and I have seizures. I can't get in the shower or bathtub by myself because of the seizures and because of being blind. If I didn't have them, I wouldn't even have anybody to help cook or clean. I lay my medicines out, all my housework, my laundry. If I have to go to the grocery store, to the doctor's appointments, she takes us to the doctor's appointments. I mean, right now, I have one eye, and the other one only has 2% vision in it. You can't see to do too much. If I didn't have access in-home care, I don't know what I would do. I'll be honest with you, I don't know what I would do. I haven't always been blind, and I've always worked for a living, and now I'm blind. I'm having seizures. I can't do the things I used to do. If they were standing in front of me right now, I'd tell the senators that this is a need. It's not a pleasure. Nobody likes being in this condition. What happens if one of these days they become this way? I mean, are they going to get in-home care? And there's so many in our building, in our apartment building, that is like this. It's in the same boat, that need it but can't get it. We don't have enough people in Ripley, West Virginia that does the job because they don't get paid enough to do it. All of us elderly, we don't have anybody taking up for us, especially for West Virginia. Senators, West Virginians want and need more care now.
Thank you so much, Treva. And thank you to all the home care workers and consumers who joined us today and shared your stories. Like Treva said, for West Virginians, care can't wait. By 2028, West Virginia will need nearly double the current number of homes we have today. But the average home care worker in West Virginia makes just $13,000 a year. We have a care crisis, and it's only going to get worse as our population ages. But there is a solution. Investing in care and more jobs, good union care jobs that pay a living wage, will both lift up care workers and increase access to quality, affordable care for families, seniors, and people with disabilities. It will bring down costs for families and build a stronger future. Together, we can make it happen. So please help us. Please take action and contact your West Virginia senators and ask them for an investment in home care. Please call 877-207-0266 and leave your personal message today, because we know care can't